us, and I just wanted to quickly introduce the panel before we get started, and those that will be answering many of your questions that are in here. So I will be going through the presentation this evening, and with a lot of assistance from the team that's present here. So we have Amy McNamara, our Associate Superintendent of Student Services and Human Resources, and of course our Dr. Nickerson, our Superintendent, who's here with us to help as well. So with that, I will jump into the presentation, as we have now taken an additional 4 minutes on this technical difficulty. So I apologize for that. So I'm going to share my screen and introduce kind of how the format of this evening will go and how we will structure through it. We've noticed that you've already started asking questions in the Q&A. So if I can just ask you to pause just for a moment on those questions so that we can introduce the format of the event and how the presentation is being structured so that we can best address your questions. So that would be great. So I'm going to share my screen and go through that right now. So, okay, we're going to go through a variety of topics this evening, all related to our return to in-person instruction. We are going to cover in-person learning safety protocols, meaning how our classroom and how our facilities are going to be structured to ensure that your students are safe when they return to in-person instruction. I will review our implementation timeline. We've been getting a lot of questions, and I think there's some confusion about when we are returning for in-person instruction. And we've already gotten some questions about that as well in the Q&A. And then we'll jump into the actual schedule overview of the hybrid to answer some concerns and questions we've been getting and clarify some misinformation out there about what the hybrid model is and what it looks like and why we're in it. We will also review the fully remote schedule, and then as well as very briefly the commitment letters that are out there and the instructions on how to review those. We have chunked the presentation this evening or organized it in by these topics. And so we will take some time to review each one of these topics, and then we'll pause to answer questions that are related to those topics. So what we would ask you is to please stay on the topic that we are addressing. So if we're talking about the safety protocols, and if you have questions about the safety protocols, please, that is the time to ask those questions. If you have particular questions about the commitment letter or fully remote schedule, while we're talking about safety, if you can hold on for us to review the remote schedule, we may answer those questions in the presentation. So if you can hold on until that time, that will be great. So, and that's the order of the topics that will be reviewed. The way the Q&A goes, on your screen, on the very bottom of the screen is a little icon where you can actually submit your questions. You will not see others' questions until we address them, and we will actually address those questions publicly. So Dr. Nickerson and Ms. McNamara will be going through those questions. I will actually not see them while I'm presenting. They will be reviewing those questions, and after each section, when we pause and unshare the screen, we will go through the themes that we have been getting throughout the presentation and address some of those questions. If there are some very specific clarifications that we can quickly respond to individuals, we will respond in our Q&A. And then if we don't get to all of the questions, we will get them at the end, because we can save your questions in our Q&A and we'll post them on our public frequently asked question document after this presentation. We do have some times here, so we do not want to stay on all of the topics beyond 7:30. So we are cognizant of the time and are going to keep this presentation going. So with that, I'm going to jump into our first topic, and that is our safety protocols. This is the overview of all of the safety things that I'm going to quickly cover in the next 17 minutes that we've dedicated to this part of the presentation. So I'll talk through what our students and staff will be asked to do daily to go through the screening process, what the COVID-19 testing protocols are for our staff and students, the personal protective equipment that we have for the in-person instruction, the physical distancing implementation, what are the hygiene and health practices that we have in our schools, the cleaning and disinfection protocols. We've gotten quite a few questions about our filtration systems, so we'll talk about that. How do we respond if we have symptoms or positive cases on our campuses, the community compact or behavior expectations of our students and community members, and how can we orient and do some training for our staff and our students. So, with regards to the pre-screening, every student and staff member will participate in daily passive pre-screening. The word passive means that they will do that at home on their own. So active would be if they're coming on campus and we're checking their symptoms on campus. So daily notification will go through a text or an email, depending on your choice, and will prompt our students, and currently is doing so with our staff. So all staff members are already going through this right now, but a student will get a text message or an email that will prompt them with a series of questions, asking about their symptoms and some exposure questions. They will have to answer that, and based on those answers, they will get a green or red status. And a green status is required for any staff or student to actually be on campus. A red status would require that student or staff member to stay at home. If anybody who has a red status, they will actually get instructions on who they would contact, on how they would proceed. I will show you what that looks like in a series of little screenshots. So these are some screenshots asking what kind of symptoms you're having. So this is what it looks like on my cell phone every morning when I log in and get a little alert that I need to do my screening. And it's asking me to, am I experiencing any of these COVID-19 symptoms? And usually they ask, are any of these symptoms new? Because some of them can be related to some chronic things like allergies or migraines or such. We also are asked if we have been exposed to anybody who has been positive for COVID-19. And then finally, we submit. And this morning I got my pass, I submitted my screening result, and I got a green notice, so a green check mark, so that green status. So I would be able to show this green status on campus. This is also going to my COVID team. So there's a person at the district office, because I work at the district office, who monitors this, can contact people that have a red status and would let them know what their next steps are. So that is our daily screening process that everybody must participate to come back. We've received some questions about testing. We are planning on having all of our staff members be tested weekly, starting in January when they come back. Our community testing, some of you may have seen some of these community testing organizations being done and organized at other sites throughout the community. So we would like to have those organized for students and parents on a regular basis at different school sites. So it could be monthly at different school sites, rotating different school sites, and we would ask and encourage, but they are voluntary for students and parents. We do think that regular testing could be a very valuable tool in our safety protocols, but for staff, they will be required to do so weekly. Personal protective equipment. All of our students, staff, and any visitors on our campuses are required to wear masks. And specifically, we've been getting questions about what kind of masks and are they, what kind of coverage on the face. We are mandating that they cover their nose and their mouth, and we are not allowing bandanas or neck gaiters. And those masks are required at all times while on campus. And if you are on campus right now, you will notice that our staff members are wearing masks, unless, for example, right now I'm in my office by myself with my closed doors and I have my mask off. Any failure to wear a mask will result in progressive discipline. So for example, if a student refuses to wear a mask repeatedly, they will be actually excluded for in-person learning, meaning they will not be allowed to be on campus for in-person learning. The school we will provide face masks should a student or staff member forget, that says forge, not forge, but forget to bring a mask. We do have additional protective gear. We have some plexiglass barriers that have been installed in our offices. So if you have visited one of our offices recently, like an attendance office where there's an increased traffic, or a registrar, you may see some plexiglass there where there's more common interactions between the public and our office staff. In classrooms, we don't have plexiglass all over the place in the classrooms or behind student desks. However, where there's a closer interaction, for example, during a science lab, we may have some additional mobile plexiglass that students can actually have in between them if they're working a little more closer together. Or for example, a science teacher may have additional plexiglass that they're distributing, like lab supplies, and they just have a lot of students coming up to them at the time. They may use that. Gloves will be provided by the school, and they're used per teacher direction if they need to use shared equipment. So if there's little tools and such that need to be used that they can't be washed all the time, students would be using gloves. Physical distancing, all students and staff are required to maintain 6 feet of distance between students and staff, and students. And because the hybrid model actually reduces students' density on campus by half, we have been working with a COVID-19 compliance team and our maintenance department. We know that we can implement this. And the lunch has been further staggered to decrease that density even more so with our students on campus. Most of our campuses have been painted already and are getting COVID ready. All will be finished by winter break. And you will notice directional traffic flow is required on our campuses. I can give you some samples of how the physical distancing will be encouraged. You probably saw these at various grocery stores and so on. This is a sample at Miramani where you can see where students will be asked to stand here. So for example, a lunch line or brunch line, or in a library where the students are asked to stand to practice physical distancing. This is a directional arrows, I believe at Las Lomas High School. This is a classroom setup where you can see how the classroom is set up to maintain the required 6 feet. You can see there are certain desks that have these signs on them where it says this space must remain empty. So you will notice that we are not removing student desks. In some instances, we're removing some furniture to make more space for student desks, but we're actually just labeling them to make sure that students are not sitting in them. And then you can see this room is in action right now. This is one of our smaller groups where we have 6 feet of distance in between our students. A teacher is teaching, and our students are enjoying their small group math tutoring right now. Hygiene and health practices. Of course, we're asking our students and staff to wash their hands, and then we have hand sanitizers provided in all of our classrooms and all instructional spaces. There's some examples of that. We also have the standalones where we can attach them to the walls, and we are really adamant that our students and staff are asked to stay home when they're sick or experiencing any kind of symptoms. Where shared items such as drinking fountains have been closed so that to discourage any kind of shared item usage. And then we have daily ongoing cleaning of frequently touched surfaces such as door handles, sink handles, bathroom surfaces, and so on. So we have increased staffing amongst our custodial staff throughout the day to make sure that these are being constantly cleaned. We are going to be asking our students to clean their own space, so their own desks, or if they're using lab supplies or maybe working in a in an art room, that they would just clean up their own space. And then our classrooms are cleaned daily at the end of the day. And then deep cleaning with those sprayer disinfectants are being done weekly as well. With regards to the indoor air quality and ventilation, all of our HVAC systems have been upgraded over the last several months, and they have been upgraded and include MERV 13 filters, have been installed in all of our HVAC systems in every single classroom and every instructional space. These MERV 13 filters are the filters that are typically found in the hospitals and healthcare settings. And then our AUHSD, we have been asked about the HEPA filters, and those our systems do not support those. We have in addition installed needle point bipolar ionization devices in all of our systems as well. And those are installed to help with the reduction and they kill pathogens as well. We do have HEPA standing filter and fans that are used in smaller spaces like offices and areas that don't necessarily have as great of a HVAC systems. And then we have set up our systems to have a continuous fan, and then of course maximum outdoor air exchange through open doors and open windows as we move forward with that. To respond with COVID-19 symptoms, we have students and staff and visitors with any symptoms of COVID-19 must not come on campus. They are supposed to follow that pre-screening protocol, and if they have that red status, meaning they have any kind of symptoms, they're asked not to come on campus. And then should a student or staff member develop symptoms while they're on campus, we do have designated campus that are spaces on campus that are supervised where those students or staff members can be isolated. We'll be asking parents or guardians to come and pick them up and remove them from campus. And then currently the guidelines are that a student must be quarantined or staff member for 14 days, or they would obtain a negative COVID-19 test and be quarantined for 10 days. Those regulations are being under consideration right now, and you might have heard that in the news, but at this moment, those are the regulations and the standards we are operating under. If there is a COVID-19 positive case on campus, each school site has a trained contact tracing team. And those were by the Contra Costa Health Department. And those tracing teams, we get notified by the Contra Costa Health Services of any positive cases. There are times when we're notified by our parents and students or our staff members prior to the health services and so on. And we work with the district staff to trace the contacts and inform them of the next steps. Positive contacts are considered those that have been in contact within 6 feet for 15 minutes over 24-hour period. So those are the members that are contacted as a positive contact. And they're quarantined then for 14 days from known exposure with the individual. We do plan on communicating to all parents and students and staff members in the building or school, and of course with maintaining confidentiality throughout the process and not disclosing any names and such. We have been asked quite a bit about the behavior expectations within our community, and in a few board meetings, we have actually presented a draft and a copy of a community compact that we would like all of our family and students to sign, because we are asking for a commitment to provide a safe, inclusive, welcoming environment to all students, and we are expecting all to commit to a responsible behavior. So all must agree to and submit a signed compact that they will follow a certain set of expectations about a behavior on campus and off campus. This compact will be reviewed and distributed during the orientation time right before the in-person hybrid learning. And then finally, with regards to this section, we will provide staff and student orientation and training all students will go through a training and orientation program prior to returning to campus for the hybrid learning model. So we will also provide staff training and professional development with regards to the instructional and curricular development. Student training programs, we will actually have some online training, which we will deploy through Canvas. And then we'll start bringing them in small groups during the week prior to actually walk them through campus, train them on the safety protocols, and show them procedures around hygiene, sanitation practices, train them about protocols, how not to spread COVID-19, what are the symptoms, what to look for screening, physical distancing guidelines, masking, and so on. So we really want to implement a very robust training program for all of our students before they come on campus. And with that, we'd like to pause now in our presentation. I'm going to unshare my screen and we'll take some, answer some questions that you've had on this topic.
So we have a good number of tests or questions available. And Amy, why don't you start with the first one about PPE for staff?
Yeah, so we have a few questions here about masks. So one of them is, what are the teacher safety measures? And for teachers, obviously teachers will be doing the screening every day. We're going to have testing for the employees, and all teachers, the ones who've been coming onto campus now, they have surgical masks like the one I'm wearing at their disposal. We have a large supply of those. We've also offered teachers face shields if they want them. We have a face shield for every teacher and then some. If teachers want gloves, we have those available for teachers as well. And teachers are letting us know if they want a plexiglass shield around their desk in the classroom. And in addition, the COVID safety team has designated markers to keep students actually greater than 6 feet away from the teaching area, so that teachers will be separated. Obviously, teacher safety is something that's really paramount to us, because without that, we will not be able to reopen. So we're taking that very seriously. And then with regards to masks will be required at lunch. Obviously, if students are eating, they can take their masks off to eat, but they will have to remain socially distant. Masks cannot have filters or valves, as Aida said. We are definitely going to be putting in some protocols at lunch so that lunch is all grab and go and students will sit in socially distant areas throughout the campus to quickly eat their lunch. So that's a little bit about masks and lunchtime. And then John, if you want to answer, we had some questions about temperature checks.
Yeah, and there was one question just came in on face shields for students, and face shields would not be a substitute for students. If there is a documented medical reason, we would work with the student. It might be something where that student needs to continue with distance learning or remote learning, but we can also evaluate a face shield with, I believe it's a skirt or around the bottom. We could examine that. So we would work on a case by case if there's a need, but a simple face shield without a mask is not adequate. So a couple things regarding, there were several questions about testing. There's a question about asymptomatic kind of surveillance testing, and we would be doing that with our staff. That's our weekly testing for staff. We don't have the capacity to do that for all students on a weekly basis. We'll be offering community events, encouraging students to attend or family members. But we really want our students to utilize their healthcare or the public health system. Right now, the public health system is a very quick turnaround. Their turnaround is 24 to 48 hours. And so, and they're opening up, I think, new weekend times within the next week in the San Ramon site. So that's something that we encourage our students to participate in, but we don't have the capacity to do that for all of our students on a weekly basis. Let's see. The question about, are we considering a phone app for contact tracing, or some device like, I know the professional teams are using devices like that. At this point, we haven't considered it. I think as those technologies develop further, perhaps we will, but at this point we have not. Consequences for students and families violating the compact. When the compact is violated on campus, that's much easier for us to deal with, and it would be addressed actively with progressive discipline, and students would be excluded from in-person learning with violations. There was an outbreak at a school just recently in the last, just before Thanksgiving break. And it was an outbreak because students were not wearing masks while they were eating, which we expect, but they were doing it inside a classroom and not physically distanced. So that type of thing would certainly not be allowed. That's what puts us at real risk. Violations at home, we would address them if we can. We would try to understand what was happening, but that's really difficult to us or for us to enforce. So we'd be really asking for that commitment of all if we're going to keep our campuses safe, but it's difficult for us to enforce things happening on the outside, although if it's presented to us, we would try to address. Aida, how much more time do we have?
I'll give you a couple more minutes.
Okay. So there's a question about contact tracing. So if a student in a classroom has a positive, we would be addressing the contacts, of course, but there's a question about whether parents would be notified. And so we will be notifying parents if there's a positive case in a building, but we won't have the specificity protecting student confidentiality that a parent might like. So contacts would be notified, but they wouldn't be given an individual's name. They would just be notified that they were a contact with a confirmed positive. Regarding whether other people would be notified of who that specific person was, they would not. But we would notify all parents if there's a positive case, whether it's student or staff in the school. So if a student is quarantined, they would still have access to class through the full remote learning option. So if a student were tested positive or were quarantined as a contact, they would access the curriculum through the full remote option through the live streaming. Amy, do you see anything else that can quickly be?
I would just say that we're going to do our absolute best to monitor students to make sure they follow the safety protocols. All of our safety depends on student cooperation. And we are really fortunate to have a lot of compliant students, to have students who have really great behavior in our schools. So I'm confident they can do that. We have hired additional safety monitors to help us with that. And there's a question here about desks. Desks are distanced 6 feet from the center of the desk to the other desk to keep students 6 feet apart. Usually it's a little bit more than that in each classroom, as we've been able to remove a lot of excess furniture to make sure we're holding at least 6 feet between students.
So, and I'll just add, there's a question about orientation day. There would be orientations and tours for students where they'd learn all the protocols firsthand in person. So that would happen. Let's see. Students who are breaking the rules would be excluded. 6 feet distancing during breaks. We have additional supervision on campus to try to ensure that. And again, we'll have discipline if the need be. Regarding the passive and active screening, our public health department feels very strongly and support their claim with the literature that passive screening is the safest way for schools, and that active screening does not add any benefit, actually brings kind of some detriments or some health risks. So that's why we're choosing to do the passive screening process.
I think we've got to move on, Aida, and all the questions that we haven't answered, we will try to do that in the FAQs later on. So we are going to copy the Q&A so we can make sure we get your questions answered if we didn't do it right now.
Okay, so I will talk very briefly about the timeline of the implementation and just about the scheduling process and when this is getting rolled out. We did kick off this implementation process at the board meeting in the middle of November and send out the commitment letters to the community on the 19th that are due on Wednesday at the end of the day on December 2nd. We plan on scheduling and making schedules in late December, and our new learning models would be implemented at the start when the county goes into the red tier. And I think there seems to be a lot of confusion about when the implementation of this program would be. So, so we want to take just a little bit of time and really clarify this and make sure that we answer questions about this. All of the Contra Costa County right now, as is most of California, are currently in the purple tier. We are not reopening our schools for in-person instruction while we are in a purple tier. We are reopening our schools when our county has the red tier data, and I will show you what that would look like. So all of our schools will reopen for hybrid instruction when our Contra Costa County reflects that red tier data. So it's not necessarily connected to a specific date of January 5th or January 19th. It's connected to the number or the tier which pertains to the COVID-19 cases in the Contra Costa County. Now we want to be able to be ready to quickly and immediately transition to the in-person instruction when we reach that red tier and not have a long buildup to it. So we are ready. All of this is getting ready for that transition. To give you some visuals of what that looks like, we send out the commitment letters in November. They're due this week. Over these 2 weeks or week and a half, we've been asking our parents to evaluate instructional learning models, look at the different resources to make that decision. And then we'll be master scheduling in December. That build up or shift to the in-person instruction. So while we are in purple data, we will maintain under the distance learning schedule, the same schedule that our students have been following during the fall semester. When the county shows the red tier data, immediately as we are notified of the red tier data, we will start communicating to the community that we are shifting towards the in-person instruction. During that first week that you see in that light shade of red, we will start shifting our schedules. We will communicate to the community and we will start communicating the student orientation schedule. During that second week that the county is demonstrating the data, we will have actually a changed instructional calendar with 2 non-instructional days that are professional development days for our teachers. We will have online safety training for all of our students and then distance learning for our students. And then during that week 3, when actually our county is in the red data, our students will be following a modified distance learning schedule, and they will be coming on campus to attend the in-person on-campus orientation in addition to being on the distance learning schedule. And then following that, they are in full in-person learning model.
Yeah.
And that's the schedule. So this is the transition to our model for the in-person learning. So again, clarification with regards to the date, because I've gotten several emails even today about why we're starting on January 5th or why we're not starting on January 19th, and when are we starting. We are preparing right now. We are asking for commitments right now, and we're getting the master schedule right now so that we can be pivoting and getting ready and implement this 3-week shift immediately as soon as we are in the red tier data, or the cases are low enough in the county, the positivity rate is low enough in the county, and we can safely reopen schools for in-person instruction. So with that, I will stop the sharing and see if there's any questions specific to this topic.
So Aida, one question that has come up is if we were to open to hybrid and the county returns to purple, would we close the schools? And the answer to that is it depends. We would be tracking county data, local Walla Mirinda data, our data at our schools, how general operations are going, and then working with our public health officials and making a determination whether we wanted to close the in-person hybrid learning or keep it open. I think, I mean, it's hard to say. Ultimately, it would be a board decision. A surge like we're encountering right now would most likely prompt us to close down. But if it were moving slightly into the purple and the school data were positive and local was good, then I think we probably would continue. But ultimately, it would be a board decision.
Okay, anything else on this, or should we move forward?
So one other, if we were, I think we all recognize that it's extremely unlikely, but if we were to turn to red in a few weeks, would we open before winter break? No, the governing board stated the earliest we would open would be the second semester for a wide variety of structural and organizational issues. And so, but then even then there would be a period where we would do some of the training and orientation and things like that before we opened. So if somehow miraculously the data turn around and we were to move to red sometime in the next 6 weeks, I think the earliest we would be mid to late January. Aida, we're getting a lot of questions throughout on changing between hybrid and in person, or hybrid and full remote. But I think you'll be addressing that later in the presentation.
Yeah, and if I don't, I'll make sure to do that at the end. Okay. Okay, so then I will go ahead and jump into the models themselves.
Amy,
Oh, sorry, go ahead, Amy.
No, I was just, Aida was muted.
Aida, I think you're muted.
Oh,
No, I hear.
okay. So I'm going to talk about the hybrid model itself first. So not the fully remote. We'll jump into that in a little bit. So this is just the hybrid or the in-person model. And I want to talk about the asynchronous instruction, how the academy works, and very briefly how the lunch works. And also a point of clarification due to the questions that I've been receiving, or we all have been receiving, is why are we going to hybrid versus fully returning and getting just all students on campus completely? And I have to say that if we could have all of our students back on campus and just do a regular traditional schedule, that would be the easiest thing for us. We know how to do full traditional schedule. We know how to do that. We are good at that. We would love to be able to do that, but that is not in our power. And that is not how we can do things. So it is our Contra Costa County Health Services guidelines that we must implement certain distancing that we just discussed. And that is the only way we can do that, is if we can bring half of the students on campus at a time. And that is, if we bring half of the students on campus, we need to do something with the other half, and that is to engage them in distance learning. So when you have a combination of students in person and in distance, that is what hybrid is. So that is why we're coming back in hybrid. We believe as a staff here that in-person instruction is the most beneficial and effective model of instruction. That is what we do best. We believe that if in-person instruction was not the best model, online schools would be the default for all of our students. But we truly believe that in-person minutes are more valuable than online minutes, that a time spent with a teacher in person is much more valuable than a time that is not with a teacher. The interaction that the students have with a teacher in person, or how they feed off each other with their peers, is highly beneficial. It's the most beneficial. And so we do believe that this is our default model. This is our priority model, and the model that we recommend highly to for selection. So we hope that our students will return to our schools as we open, because we do believe that we can reopen them safely. We also want to say that we completely understand that there are circumstances in all families due to which students cannot return because of their personal health conditions or health conditions of those they live with, or some particular family circumstances. And because of that, we've worked really hard to create a model that doesn't remove them from the classroom or changes their schedules or their teachers. And that is the fully remote instructional model. So I want to review the schedule for the hybrid and what that means. You've probably already seen the schedule, and the students are divided into two cohorts. And for lack of creativity, we've named them cohort A and B. And on the schedule, you can see where those cohorts are listed. And you will see what kind of instructions that cohort is following. So when your student gets a schedule, hopefully by winter break, if I am a student in cohort A, I can see that on Tuesday I will be in person, and on Wednesday I will be in remote synchronous. Students will attend 4 days of synchronous instruction. And by now, I think we are all getting fluent in what those terminology means. Asynchronous is when students are on their own or independent. Synchronous or live is when students have an interaction with their teacher every single period throughout the day. So for 4 days of the week, students will have interaction with their teacher every single period. That interaction may look different depending on the lesson, depending if they're in person, depending if they're virtually, or what's happening in that department on that day. But they will have a live interaction every single period with every single teacher, 4 days a week. So they will, it's very different than what Monday is. Out of those 4 days, 2 days are in person and 2 days are virtual. I'm calling them a little different than the distance learning right now, because it is a different model than what we're going with what we're experiencing right now. So I want to follow through a little bit. If I was a student in cohort A, if I'm a student in cohort A, on Tuesday and Thursday, I will come to school and be in person. And I'm going to take a little bit of a moment here to address of why we have reorganized the periods, because this is the question that we've received quite often throughout this process. Right now, not on the schedule that's on your screen, but currently in distance learning, our students go through on Tuesday periods 1, 2, 3, 7, and then on Wednesday they would go to periods 4, 5, 6. We have reorganized the periods for curricular reasons and for reasons to give our students more consistency of how often they come in to school in person. So if I'm again in cohort A, under this reorganized schedule, I will come on campus on Tuesday and on Thursday. So, and then I will be engaged in virtual instruction on the other 3 days. If we did not reorganize the periods, and I was attending school periods 1 through 3 on Tuesday, and then 4, 5, 6 on Wednesday, I would be coming to school Tuesday, Wednesday, and then I would be going home. So I would go to school Tuesday, Wednesday, and I would go home Thursday, Friday, Saturday, Sunday, Monday. So while throughout the week, it's the same number of in-person days and same number of at-home days, it's 5 days in a row of at-home instruction, with our teachers in the work group felt was not a good thing. So we felt it was a much more valuable thing to have our students come on campus in this manner versus having 5 days in a row of at-home instruction. And this is much more so for students, especially who are struggling in school, and those that need consistent in-person seeing. We also noted that for students curricularly, for example, if I'm teaching Living Earth or science first period, and I'm setting up my labs first period, and I'm engaged with students in person, and then it's flip-flopping with my curriculum, with my cohort that's at home, I want to see them the next day so that I can immediately do that lesson the next day versus waiting an entire day and then doing that same thing on Thursday and then flip-flopping it. So curricularly for our teachers, it made sense to have those periods back to back versus having a full day off before they switch what's happening with those cohorts. So those are the reasons we regrouped our scheduled days. So again, if I'm a student on campus, on cohort A, I'm on campus Tuesday, Thursday, and then on Wednesday and Friday, I'm at home. What it looks like for a teacher and how the engagement looks like. I'll give you just a couple examples that I think put out in some of the presentations. Different lessons would look differently. I'll use a science lab example. So if I'm having a lab that I'm conducting, I would bring both of my cohorts together during my first period. I would take my attendance. I would probably do my warm-up problem together. I would go over the agenda for both of the groups, make sure that we understand what's happening in both of our groups. And then because I'm doing a lab, I really want to make sure that my in-person group is engaged in hands-on activity that day in a lab. I mean, that's why we're bringing them back on campus. So I would release my virtual cohort to be doing the activity that I have assigned them to do at home, which would be a topic related to whatever I'm covering in class. And then my full focus would be on the kids that are in front of me, that they are doing whatever the lab is that I'm doing. And then I would switch and flip-flop the next day with that activity. I may bring them at the end of the period and we can have a discussion of what's been going on. I could have a social studies class where I'm actually keeping both of the cohorts for full period together. Maybe I'm doing a Socratic seminar. Socratic seminar, you usually have one group that is maybe doing like a fishbowl, like a group that's discussing something, and then the outside group is observing that discussion, listening, taking notes, and then they're switching who's on the inside circle, who's on the outside. My inside circle could be my in-person kids, so they're giving a prompt that they're discussing while my virtual cohort is observing, taking notes, as if they were the outside circle during in-person instruction. And then I'm going to flip-flop while my virtual circle is doing a discussion and my in-person circle is maybe doing an observation. That's a way to actually have both of my cohorts interact if I wanted to move my instruction forward for both of those periods, as opposed to having it flip-flop both ways. I could be teaching a math class and I really want to provide 25 minutes out of the 75 minutes of very direct instruction to both of my cohorts. I could go through my example of whatever I am teaching, Pythagorean theorem that day, and I'm going to go through my example. I'm going to provide very direct instruction. And then I want to give some support time. I'm going to maybe release my virtual cohort to do independent work. And then I'm going to actually do some small group or individual support to my students that are in front of me. And then the next day I would switch on what's happening. So that's a way that those classes can be structured. So that's what I'm saying. It's dependent on the lesson and the time of how much time those groups are spending together. We have been talking to the schools and districts that are doing this successfully and have been really impressed in how the teachers have been able to manage those couple of cohorts together and what they can do. Monday is pretty much the same. It's asynchronous or independent instruction as it is right now. So it looks very similar with students attending the cohort academy together and then being involved in independent asynchronous day or time. Excuse me. Then we have academy that is built in throughout the day. Currently, our academy is virtual and it is optional. We are currently having anywhere from 10 to 15% of our students accessing the academy in the morning. It has not been highly successful. It is successful to those that attend. Unfortunately, if 90% of our students are not attending, can't say that it's being highly utilized. When it's embedded in the schedule, every student has to come in. During virtual academy or distance learning, we cannot mandate academy because we actually can't serve every student in Zoom for academy. We can't provide intervention on Zoom for all of our students during academy time. So the academy is staggered with lunch. So students are further narrowed down to a quarter of the students. If I have half of my students on Tuesday, so cohort A is present on Tuesday, which is 50% of the students, then they're further split. So quarter of the students are present during the academy 1 or lunch 2, and then or lunch 1 academy 2. So that even narrows down even furthermore how many students are there going out to seeing their teachers and getting support in their classes. They will sign up through Teach More, which teachers to see who do they get support from, and teachers will specifically tag them as well, which teachers, and there'll be a limited number to make sure that there's individualized or small group support in those classes. The academy is available for in-person instruction only, so students that are at home. So if I'm cohort A on Tuesday, because I'm on a virtual day, I will not be attending academy and my lunch is just extra longer. And I think that brings me to the end of the hybrid schedule. I will stop sharing and see if there are any questions.
Aida, I know it's in one of your FAQs, but perhaps you could articulate a little bit what that virtual classroom might look like for the cohort that's at home, where they get the synchronous instruction in some different class periods or different.
If we can hold on to that, we'll address that during full remote.
Okay.
Yes. Any hybrid, yeah.
There's questions about kind of the blend between the full remote and so
why don't I go through the full remote and then we can go through those
questions. To the questions. Okay.
Sure. Okay, I will do that. Okay, so the full remote model, again, we are strongly recommending that this is the model that is selected by those that have family circumstances and health conditions. And we are very pleased that right now, during our survey, we are seeing that majority of our students, I think it's over 70%, are selecting that they will be coming back to in-person instruction. And we can really develop that model and so on. One of the concerns that we are hearing from the students that cannot come back is that they are still treated and they really well, and that they are provided a strong curriculum model. And I want to assure that group that we want to make sure that we do not penalize you because you cannot come back to in-person instruction. So when we first started, way back a few months ago, we had a whole different model, and I think there's still some misunderstanding of what this would look like. So this is the schedule for the students that would be coming back in a fully remote schedule. Those students will be placed in cohort C, and you can, and that cohort will be grouped with and follow one of the other cohort schedules. So on your schedule, you can see where that will be written. So I may be cohort AC, basically, or you may be cohort BC, and you will be following a schedule of that cohort throughout the day. What will happen is that you will attend one day of fully asynchronous independent instruction on Monday. So on Monday, your day would look exactly the same as the day, as the cohorts A and B. I will talk about those support options at the end in just a minute. So because that's the difference in the two schedules. The students would still attend 4 days of that synchronous instruction. And when I say asynchronous, again, reminder, they would have a live engagement with their teacher every single period in some manner. Okay, 2 of the days of that live instruction, students are observing, didn't know what term to use here, but they're observing in some way, participating in that in-person instruction through a live stream option. And then the other 2, and those are the 2 days if I was in cohort A. So if I'm in cohort AC, meaning I'm a student in fully remote, and I'm grouped with group A, on Tuesday and Thursday, as shown in this schedule, I will be following the cohort A, and I'll be watching through a live stream option what's happening in the classroom. It truly depends, that experience, on what is happening in the classroom. On some of the days, and I'll use some of the examples I just used in the hybrid model. If the teacher is doing a Socratic seminar where both of the groups are engaged in a discussion, the group in the students in cohort C would probably not see any kind of a difference in the engagement. They would be fully participating, as they would be part of that group that is fully engaged in a discussion, as they would just be divided in a discussion. If a teacher is using this group, this time, to push the instruction forward for both cohorts, meaning they're doing a direct instruction, they're lecturing on a math concept or science concept or English or whatever it is, for a section of that period to both groups or all 3 cohorts in this case, there would be no difference at that time. Where the difference is when the in-person students are engaged in a discussion that is only done by the in-person students, or a lab or hands-on activity, or anything that is truly hands-on done in the classroom. What we have seen some rumors about is that our students that are in the classroom will have laptops in front of them and Zoom partners at home, and they will be Zooming the entire time. That is not what we're bringing our students back in the classroom. So unfortunately, while there will be a camera in the classroom through an iPad that is mobile, and our cohort C students will be included to observe what's happening during those hands-on activities, they're not Zooming the entire time one-on-one with our students. So if I'm doing a lab and there's a dissection happening, the students may be through an iPad monitoring what's happening, or I have a group of 3 people and they're doing a lab. Or I'm in an auto shop, or we're throwing clay in our art room. I can't recreate that for somebody who's live streaming or somebody who's at home. We can have them observe. We can have them take notes. We can have them possibly talk to those students, or they can talk to them later on during a discussion, but we can't have them engage in those activities. And we want to make our in-person instruction as rich as possible for our students.
Yeah, I'm
So
trying
we
to
want
avoid
to,
that.
sorry, John, you're not muted. So we want to engage those in-person activities. So those students, for those cases, they would be observers through live streaming. Our live streamings will be happening on iPads that are on stands that are mobile, so that we can actually bring them to a lab table, or we can bring them to an auto bench, or we can bring them to an engineering bench. But if our students are building something or they're having a hands-on stuff, they will not be able to participate. They would be observing that. During the 2 days that are asynchronous, during the live instruction that are virtual. So again, if I'm on Wednesday, Friday during the cohort AC, those students would be doing exact same thing as the students are doing in that cohort, in-person cohort, because they're starting the class together virtually, and they're doing whatever the assigned activity is virtually. So that could be whatever that is, because they can do that exact same thing. So that's the difference of what that would look like. And I hope I'm explaining that. The other big difference in the model is the academy, because the academy is in person and the students are not attending in-person instruction. We have developed these drop-in office hours, and they truly are office hours. Now, the students, we have offered 3 options for our teachers when they can do that. So if I'm a science teacher, I would select one of these 3 options of when I am going to offer it to my students. So I would say, hey, my kiddos, you can come see me on Monday from 10 to 11. That's when you can see Mrs. Glimmy for your support. Ms. McNamara may offer her social studies support on Thursday at 2. This is done to allow some options for our teachers as they have different meetings during those times and they can't all attend, or they teach different classes. And it's also done to split up those options for our students. So not all 7 of students' teachers are offering the support during one period. So they're not necessarily academy classes, they're office hours, and they're offered at 3 different times to kind of spread out their teachers. And the student will drop in and ask questions of whenever that offering is for that teacher. And then during lunchtime, they have additional lunchtime time at home as opposed to the academy. I'll address the switching of the schedules at this time. At the start of the school year, when you think about during regular times in good old days, we would allow for the first 2 weeks of time, or during first 10 days, for our students to evaluate if they're in the correct level. Usually, so for example, if I've signed up for Algebra 2 Advanced, and I found myself to be really in over my head, and that is not the appropriate level for my class, that I could go to my counselor and switch out of that level and go to Algebra 2. And hopefully there's room there. So that's really what we're thinking about in this case, that I've signed up for virtual model, full remote model, and I'm seeing what's happening in the classroom. I can do this. And during those first 2 weeks, I want to go ahead and change and come in person, or vice versa. We've never done this before. Our schedules, as you've heard, are dependent on facilities that are limited. That's why we're asking for commitments right now. So we have some classes that are large. If we know how many students are opting to stay in virtual, we can plan and schedule. If a lot of our students opt out and now suddenly want to come back in, we may have some limitations to that switching. So that's my concern. And that's why we're not so like fully committed to like, yes, of course, you can do as much switching as you possibly can in the first 10 days, because we just don't know what it's all going to look like. So we just don't want to overpromise and then not be able to deliver. So we're really asking you to look at weigh all of your options right now and see what your family decision is to make a decision right now, as opposed to waiting and seeing what it looks like. But with that said, we also know that things change and circumstances change. So we want to be flexible as much as we can in those first couple of weeks. Once the school gets going in these two models, we know that our teachers may need to adjust some assignments that are given in the two different models. So our students that are in cohort C may be given some different assignments here and there, or they're slightly different than those cohort A and B that may start looking different in a grade book. So to suddenly start going back and merging those classes and bringing students back into the classroom at any point during the semester may be a challenge. And that's why there's a limit to how much change or how long the changing can go on. I've been asked a lot, what if there's a vaccine? Those are all such big changes. If everybody suddenly gets vaccinated in April, that's a whole different system. So we're talking under these current conditions, what we can do. So I will go ahead and stop sharing and answer questions that there may be.
Aida, can you explain again the when students are in full remote, how they would be paired with a cohort A or B, and that they would Zoom the entire period when that cohort was in person, and then when that cohort was not in person, they would Zoom whatever piece was virtual for that cohort?
Yes. So if I'm cohort AC, meaning or CA, however you want to say it, on that Tuesday, I would be watching the entire period, Zooming in the entire period. Part of that discussion, part of the interaction is whatever the teacher is doing, or I'm part of the discussion, or I'm observing what's happening in a classroom. So sometimes I'm an active participant because of what the lesson is. Sometimes I'm a more passive observer if the lesson is hands-on. So that's the difference with regards to, but yes, on those days, I am fully live streaming and watching the classroom, while on the days that I'm virtual, I'm 100% doing everything that the other cohort is doing because they're virtual as well. I hope I'm clarifying that.
Yeah, and then a question about kind of, because this depends on the teacher and the topic, but if they aren't necessarily teaching the same lesson from Tuesday to Wednesday, but they might be. So can you explain kind of how that works?
I'm not sure that I understand your question. Can you clarify what you're asking?
Yeah, so the question was, so is the teacher teaching the same concept twice, one to cohort A and another to cohort B, which might be true, or just once to both A and B, but one group is in person and one group virtual? So I know it depends.
It depends. I would not say that I would be teaching the same exact thing twice, but it could be. So depends on what it is. Again, I'm going to use the lab because, and again, I use a lot of science examples. I apologize because I was a science teacher. So if I'm going to teach like a little lecture, if I want to teach about a photosynthesis, I would not be teaching the photosynthesis twice to two of my cohorts. I'm going to bring my cohorts together and I'm going to do that lecture for them together. I'm not going to lecture more than 20 minutes. So I'm going to do those 20 minutes to the same class. but then I'm going to have them do different activities separately. So I'm going to do my photosynthesis lab in person because I want to interact with my kids. I want to have them interact with each other. But the worksheet that they're doing, or the analysis of the lab, or the introduction that they can do on their own, they can do on their own. Or even better, what I have heard from some of the math teachers, some of the really successful stuff that's been happening is doing some flipped classroom stuff. So I may record myself explaining the math problem and send that out actually on a Monday. The kids would watch that on a Monday, or even at a start of a Tuesday, Wednesday class. And then in person, I'm going to go through and say, hey, you two, I need to work with you in person on this. And you three, I need to work with you on this. And you four are going to work on this. While at home, they're doing something else. So it really is depending on what's going on. So there could be some circumstances where we're doing the same exact thing that the teacher's doing to the two classes, but I actually don't think so. There's really what we're looking at is, what am I going to do together with them? And what are they doing at home independently? And what do I need to do in person? Because we really want to maximize the in-person instruction and then leave what they can do independently on their own. When you think about 90 minutes of when we're in traditional schedule, there's a lot of things that students are doing by themselves, in small groups, independently. And what we've done in distance learning is really parsed out is some of the things are done independently by kids at home. We can do that right now too. So what must be done in person, we want to do in person. What can be done at home can be done at home. And that's how we're looking at hybrid. So that's really what's happening on those 2 days, as opposed to saying, I'm just going to do the same exact thing to two cohorts, if that makes any sense.
Aida, I had two questions here. One is that maybe I can answer. One is around, have there been cases where students have contracted COVID in one of our small groups on campus? And I want to say this, we have shut down a couple of the camps twice due to a positive COVID test. And we have had students who have tested positive for COVID. What we have not had yet is through contact tracing, a case of COVID that was spread on campus from students to students. So these were students, the last one was a student who was visiting a parent or an elderly relative, got tested, was an asymptomatic positive. Obviously, we shut that camp down for 2 weeks, but we are not aware of any spread in the camps because of that. That's not to say that that might not happen. And we are committed to providing a dashboard with our staff testing positivity rates, our community positivity rates, that will be updated because we are going to be doing the weekly testing with employees and monitoring the community spread and positive cases that we know of through contact tracing in the county by students. So that dashboard will be transparent, will be on our website, will be updated regularly for parents to get that information. But I do want to make that clear and kind of squash any rumors out there around that. There is COVID in our community. Students have contracted it, but we have not had a spreading event on our campuses up to now. The other thing, Aida, I wonder if you could speak to a little bit the decisions made around academy time, and can students who are fully remote come to in-person academy? I think the answer is no to that. But there are some designated hours, and then around the thoughts around making academy back up to lunch. Can you talk a little bit about that?
Yeah, so the timing on the academy with lunch was specifically done so we can stagger the lunch, and that has to be done if we flip-flopping of lunch and academy. So we have to put it there with regards to the schedule. And we really wanted to do it for safety reasons at lunchtime and make sure there's physical distancing. And then also it allows for fewer kids during academy, which allows for better intervention time and more support during academy. So that's the scheduling purpose. for the students that are coming in fully remote for Academy, and we've actually gotten questions like, hey, can my student just come in for certain electives? Or can I select and come in half remote or half hybrid? We would love to be able to accommodate that. I am a huge supporter and proponent of Academy and would love to have everybody come in on Academy. But we have really tight safety protocols on our campuses. As you saw, like we have directional arrows and we have everybody coming in pre-screened, and we are checking that in the morning. And we have increased staff monitoring who's coming on campus, what time, when, how, who's leaving to go to the bathrooms and how are they doing it and what's going on and how is the movement. To have students be coming on campus at any time during the day and leaving during the day really interferes with those safety protocols. So we cannot allow students to come in on campus just for specific sections of time. So Academy or classes that are selective classes out of their schedule. So I just hate to say no to something like that, but it's unfortunately for us, it's either like we have to have a structured protocol or not. And these are the days that we have to have those kind of inflexible protocols.
Aida, I know you need to move on, but two quick questions.
We're okay. We're okay on time.
Okay. Still getting a lot of questions about movement between the cohort C and the A and B. And a lot of questions assuming it would be easier to move from hybrid to full remote cohort C, which I think mechanically is true, but there still could be limitations after the first few days based on kind of the assessments. Is that correct?
Yes. So what our teachers, when we had a working group, our teachers were saying, look, assessments are very different in how we do things in distance learning versus in person. We want to bring our students back in person so we can start doing some of the things that we haven't been able to do. So therefore, if we start branching off a little bit, there's going to be a difference in what's happening in some of the assignments that are given or how the experience is between the students in two cohorts. But we don't want that to happen. We're going to try and keep that as narrow as possible. We just know, and our teachers are saying that's going to happen. And the further we are from the starting point of when these two models begin, we just don't want to go through a big movements in and out. So that's the issue with regards to movement. And we are trying to value, and we want to value our teacher input on this because they're the professionals sitting in the classroom in there. And I think that the movement of students in and out of the models can be really disruptive. This is a huge challenge on our teachers and a huge lift on them. And to, on top of that, increase that disruption of students moving in and out through the entire semester would be an additional challenge, which we just have to start narrowing that down a little bit in those cohorts.
Aida, one of the questions was around teachers who may have health conditions zooming into their classrooms and having a sub in the classroom. Can you describe what that would look like a little bit?
Yeah, so we're working on that right now. And we know that we have, just like with our students, we have some staff members that are highly immunocompromised and cannot come back to in-person instruction. We heard actually loud and clear from some of our parent leadership that they would prefer, one of the top priorities from our parents was don't change our schedules, don't change our teachers. We would rather have our teacher continue on distance learning for those periods when we return to in-person instruction than have a complete disruption of having our students either eliminate that class or bring in an unknown substitute. So for those teachers that have those verified conditions, we are allowing them to live stream in. So what we would allow is that a teacher is actually live streaming into the classroom. Our students are on campus for that period. And we have a few of those. They're not common, but there's a few. And we would have a substitute or an in-person person to monitor what's happening in the classroom. That could be, if it's we're trying to actually get some new teachers in training to be in the classroom so they can actually do some of the in-person stuff. But a teacher that is a current teacher would actually be the leader of that curriculum. They would plan all the lessons, do all the grading, do all the curriculum development, and the substitute in the classroom would just really be the monitor of what's happening or the facilitator of that in-person work. So that's really what that would look like. We're still ironing out the details of that and what all the details are of what that space would look like, how would it all look. And it's really dependent on the person that's supervising the classroom. If it's a teacher that's just about to get their credential and maybe it's the same subject area as that is mine, that teacher can do a lot of the things in the classroom and that classroom can move forward. But if it's somebody who doesn't have that expertise, it would look very different. So it's really going to depend class to class. Anything else? We have 2 more minutes. I could just do the last section.
Yeah, I think if you finish up your slide, there's some more general questions coming through.
Okay. So just finally wanted to quickly cover just the commitment letters. We have commitment letters that are due on Wednesday. We have sent the links to the survey through an email and they are on the district website. All of our parents are asked to communicate or respond by December 2nd. This is what the survey looks like. We're asking information literally about, the name of the parents and so on, student name, and then are you coming back or not? Oops, I now cannot go back to my presentation. Oh, there we go. And then the last thing is that there's a website with all of these resources. If you've missed anything, and then the frequently asked questions where we will be posting this information. This is what the website looks like. It's very specific to this commitment letter information. You can, if you really would like, look at some of our old board meetings that are referencing this. There are still some school site specific meetings that are coming up, and then you can see here, I know Campo Lindo is having theirs tomorrow, and I believe all the other schools have held theirs already. Here under the resources is where you can access the questions that I've been referencing. So we have already posted quite a few frequently asked questions, and they are also divided into these sections of schedule, curriculum, safety, even some extracurricular activities. We are getting questions about, for example, can my students still attend extracurricular activities if they're in fully remote? Our answers have been that yes, they can, but if they're medically compromised and they can't attend in-person instruction, we just would question that if they should be able to do that. Oops, excuse me. And then, oops, because of I'm trying to access this, but I apologize, the way my controls are working, I can't do it. There we go. Under these resources as well, where you can see is little short videos that have taken basically this presentation into small sections. So, and there's actually quite a couple more than what it is right here. So there's instructions on how to complete the commitment letter, overview of the hybrid schedule, fully remote schedule, implementation, safety, some decision trees, like what happens if you have symptoms, what happens if you test positive. You can see the videos, you can only look at the slides, and then we have bell schedules and so on. So a lot more resources right there that you can access. And that brings us to the end. So if there's any last final questions, we can answer.
There's a question that just came in about quarantining and joining the cohort C or the full remote.
Oh, sure.
So if you're hybrid, in the hybrid option, cohort A or B, and you need to quarantine either because you're a contact or you were out of town, for whatever reason you need to quarantine. Can you address that?
We really do not want our kids to come on campus sick. So that's the nice thing about this model, is that if you are in a forced quarantine or you are feeling ill or you've been exposed, that you actually can join in through the live stream option during the full remote for those 2 weeks or the 10 days or whatever the quarantine period is. So you would just, you'd be informing your teacher that you're doing that. We clearly do not want this option abused for all sorts of ways. We do not want our students that are traveling, on ski trips or whatever else they're doing to be picking and choosing cohort C for that day. So this would be selected only for illnesses like this. So that they would be attending with cohort C for that time period, and then rejoining the in-person learning as soon as they're out of the quarantine.
And several questions about can they resubmit that several people have said that they now want to do hybrid after listening to your presentation. Can they resubmit? And I think the answer is yes. And of course, the other way, if you now are interested in remote, you can resubmit. We'll take the most recent.
Yes. So what we've been actually getting, and our principals and myself have been getting some questions over the last couple of days. How do I resubmit? If you go in through the survey and answer it again, what we will do is take the latter of your submissions, and we will eliminate your first submission. What we will do over the next 2 days is do some targeted communication to the parents of students who have not submitted a survey at all. And then on Thursday morning, because the survey closes Wednesday night, on Thursday morning, we will actually send confirmations to all parents saying, hey, we've received your commitment letter and here's what you have selected. So if you're one of those that are changing your mind, which I understand, we want you to decide based on the information, not anything, not misinformation. So if you have changed your mind, make sure that you check on Thursday that confirmation letter and that it's correct, so that we have the accurate information.
And I know we're past the end time. There are hundreds of questions that have not been responded to, and I know that we will very quickly grab some of the more general questions and particularly repeating themes and get them in the FAQs. Do use those resources. Ms. Glimmy pointed out they're very thorough and have lots of answers in them. I will also say that if you submitted a correct email address with your question, and it's more specific to your situation, we'll try in the next 24 hours, we'll try to respond with some answers to your specific situation. And I think that's it.
Okay. Well, thank you so much for attending, and I appreciate all the questions, and we will start answering them tomorrow morning and get them posted.
And this presentation will be posted tomorrow morning as well. Thank you all for attending.
Thank you.